See this partograph, they will give you as a ops table একটা ইয়ে থাকে ভাইভা থাকে ops ভাইভাতে they will give you a partograph and they will ask you questions. Okay, what is partograph and tell the significance of it, and বিভিন্ন রকম partograph আছে. Okay, and they will tell you to ask you to tell about the diagnosis. Ultimately কি হয়েছে, partograph is a graphical representation of labor events such as cervical dilation, descent of the baby, maternal details and fetal details with the time. See এখানে time দেওয়া আছে. See 1 2 3 4 5 6 7 8 9 10 12 hours. Okay, among this time graph we are plotting the cervical dilation, fetal components and the maternal components. I will tell you later what and all. So this is partograph. Partograph was first designed by Friedman. Initially, this is WHO modified partograph. Okay, initially partograph was not like this. It has been modified later on. See, this is time. This is cervical dilation. Need to note this and all. I am just for your reference I am saying. See, how do you note cervical dilation? You have to do pervaginal examination. Okay, you have to do a pervaginal examination and you have to see how much the cervix has been dilated. Imaginary act in your mind, no, you have to make it like, see, this is the cervix and uterus is behind this. Okay, I am doing a pervaginal examination and I will measure cervix is dilated or not. See, in this it is 2 centimeter dilation. See, now it has become 4 centimeter dilation, and if it is more, now it is 6. Okay, so I will imagine like that. Labor, no, it is divided into latent phase and active phase. Latent phase matlab, see, from 0 to 3. Okay, this is latent phase. Latent. After latent phase, there is active phase. Okay, this is latent phase. This is active phase. Active phase has 3 components. Okay, this is acceleration. Acceleration phase. This is maximum slope phase. This is deceleration phase. Okay, so this acceleration phase, no, it starts from 4 centimeter dilation. So 0 to 4 centimeter it is latent phase, 4 to 10 centimeter it is active phase. Initially Friedman developed, he included the latent phase also, but latent phase, no, it will progress and go on till 8 hours. 1 2 3 4 5 6. After 8 to 10 hours only the acceleration phase, the active phase of labor starts. Initially Friedman developed this partograph which included the latent phase, but for it was very time consuming. ঠিক আছে, how a patient is getting admitted for 8 to 10 hours, we are monitoring her for no use. So later WHO has modified the partograph, cutting this latent phase. After this WHO has modified latent phase nahi ekon. So do active phase we start from 4 centimeter. See, that is why, see, this 4 centimeter there is a line called alert line. Okay, so the plotting of the partograph, WHO partograph, will start from 4 centimeter dilation. This is very important. And watch what modification we have done. One is there is no latent phase. Initially in here the plotting started from 3 centimeter. Now it has started from 4 centimeter. Okay. So what and all does a partograph have? See, it has the patient details. See, name is there, gravida, para, hospital number, date of admission, time of admission, at what time the membranes are ruptured. After that, there is fetal component. In fetal component, there is fetal heart rate. See, from 80 to 200. What is the normal fetal heart rate? 160? Yes, 110 to 160. If it is less than 110, 120, what do we call? It is fetal bradycardia. Okay, if it is less than 100, it is severe bradycardia. If it is more than 160, we call it tachycardia. Okay, so this one box, no, this small box, it is half an hour. This completely, this two box is 1 hour. This is 1 hour, this is second hour, this is third hour, this is fourth hour. So you should know that one small box is 30 minutes. Fetal heart rate we monitor every 30 minutes. See, that is why after the end of the small box, see, first initially at 140 they have marked. After half an hour they have again checked, it is 140. Then after half an hour they have again checked, it has dropped to 130. Likewise, every half an hour we have to monitor the fetal heart rate. After that, there is a there is a column for amniotic fluid and molding. See, the first line is amniotic fluid, second is molding. Amniotic fluid, we should say what is the color of the amniotic fluid, or if the amniotic membrane is intact or not. Labor shuru hoega se after 4 centimeter dilation, okay, the membrane will bulge out. কিছু সময় কি হয়, membrane automatically rupture হয়ে যাবে, না হলে membrane rupture হবে না. If it is, we have to say what is the color of the amniotic membrane. If it is meconium-stained, we will write M. If it is clear, we write C. If it is not ruptured, intact, I. If it is blood stained, we write B. If it is absent, meaning there is no amniotic fluid at all, it has totally drained, we write A. For example, see, in this file they have written C, meaning clear, 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 and at last it is blood. B, 1, 2, 3. Meaning last 3 halves, last 1 hour it has become blood stain, and after blood stain it has become M. Blood stain hoyeche, tarpor ultimately meconium stain hoye geche. Okay, from this I can understand, okay, there is a meconium stain labor that is happened. After that, molding. What is molding? I intact, meaning rupture hoy nai. Fetal skull has 2 bones, no, about 2 parietal bones ache. See, when baby's head is delivering, no, see, this is the vaginal cavity, baby's head is getting delivered. To come inside this cavity, no, the baby head, the skull bones has to accommodate inside. It has to get squeezed. So what it undergoes a process called molding. In molding, what happens? See, these 2 parietal bones, they come and touch each other. Sometimes what happens? It gets overlapped. That we call molding. Normally, it is reversible. Meaning after birth, it will again come back to normal. But in certain conditions, severe cephalopelvic disproportion, or if the CPD is more and the time of labor is prolonged, inside the vaginal cavity it is molded for so much time, it will become irreversible. Mane এরমই থেকে যাবে, আবার normal হবে না. Okay, so molding is, we can grade into 0, +1, +2, +3. Okay, 0 means bones are not touching. 2 bones are not touching, means 2 are separate. This is touching, but not overlapping. Mane bones has touched each other but it has not overlapped. Here 2 plus mane overlapping but separable. This is overlapping, unseparable. So 0, it is not at all touching. 1 plus, it is touching but it is not overlapping. 2 plus, it is touching and overlapping, but after delivery it will become normal. It is separable. 3 plus, it is touching, it is overlapping, but it is unseparable. Money, it will be like this only, it will not come back. So molding they have checked. So initially it is 1 plus, 2 plus, and finally it is 3 plus. This fetal heart rate we will check every half an hour. This molding and amniotic fluid, whenever we do pervaginal examination, at that time we have to check. So every 4th hourly we have to check. Sorry, amniotic fluid, so whenever it is, the fluid is coming only, we can come to know about that. After this, there is cervical dilation and descent of head. See, from 0, 1, 2, 3, 4, 5, 6, 7, 8, 9 till from 0 to 10 they have written cervical dilation. 0 to 12 they have written 12. So this is time. This is cervical dilation. Okay. So WHO modified partograph, we start plotting at 4 centimeters. Whenever the patient comes, okay, if patient comes, we will start marking the partograph when she has started dilating 4 centimeter. 4 centimeter आगे patient ऐसे गए, but she is 2 centimeter or 3 centimeter. We will not plot the partograph. We will wait till it is 4 centimeter. 4 centimeter होएगा चे, then they have marked. See, there are 2 lines. One is an alert line, one is an action line. Okay, right to the alert line there is action line. From alert line to action line there is 4 hearts gap. This 4 hearts is very important. Okay, we have to have in our mind that the vaginal delivery should progress within the action line. That is the safer side. If I'll explain. Okay, see, we will do pervaginal examination every 4th hourly. Patient admit hoye se 10 o'clock. Patient came at 10 o'clock. At 10 o'clock, it is 4 centimeter dilated. So I marked an X on 4. After 4 hours, 10, 11, 12, sorry, then 1. See, 1 o'clock, again I have marked, it has become, sorry, it has become 6 centimeter. After 4 hours, again I did PV. From 4 centimeter, it has become 6 centimeter. Then again after 4 hours I am checking. See, 2, 3, 4, then 5. After 4 o'clock I am checking. It is same. It is still 6 centimeter. That I have plotted. See, it is giving a line. That line, no, it has crossed the action line. Normally this line should be within this alert line or within this, between this alert and action line. If it has crossed action line, we have to take some action. Either we have to induce the delivery or we have to do cesarean section for the patient. Okay, now it has crossed the action line and we can see there is meconium-stained blood also, and we can see that there is fetal distress also. See, fetal heart rate has also dropped below 100. At the same time, fetal heart rate has dropped below 100. Meconium-stained blood stain it is there, and there is prolongation of labor. 6 centimeter only it is there. It is not getting dilated more than 6 centimeter. So see, we have done cesarean section at 5:30 a.m. Okay, you are trying to understand. I will explain again in the next thing. So in labor events, we plot this cervical dilation and descent of head. How will you know the descent of head? How will you measure the descent of head? No, not with fundal height. There is something called 5th method. There is something called 5th method. Vaginal dilation cervical dilation আমরা PV করে আমরা দেখে নিচ্ছি কত dilation হয়েছে কি। but head descent আমরা কি করে ভাববো? How do we know if head is descended or not? For that we have see hmm. No, even if it is buttock, it will be soft only. Okay, if it is breech, it will be soft. In that examination, third, what you are saying, in that Low's manure, third grip, third fundal grip, we can say if it is the head or if it is the breech. Head আছে না buttock আছে না shoulder আছে, we can say that, or we can say if the head is flexed or not. কিন্তু কত নিচে আসছে ওটা আমরা বলতে পারবো না. For that we have something called fifth method. See, this is maternal abdomen. Okay. This is baby's head. Okay, what I do, I keep my hand over the abdomen. Okay, in my 5 fingers, I can feel the fetal head. Okay, after sometimes, see if it is, this is the head, baby is like this. I mean, pete hath dichi, I can feel with my 5 fingers. After some time, what will happen? The head will descend like this. Okay, now I am keeping, I can feel with 4 fingers. This is 4 out of 3 palpable. Sorry, 4 out of 5 palpable. Now it has again descended. Now see, it is 3 out of 5 palpable. Now again see, it is 2 out of 5 palpable. Then it is totally descended. So 5 out of 5 ache, 4 out of 5, 3 out of 5, 2 out of 5, 1 out of 5. Okay, when it is 2 out of 5, we say head is engaged. See, from 0, 1, 2, 3, 4, 5. This 5, we have to mark the descent of head. See, the descent of head is from 0 to 5. So, how much it is palpable? For every 2 hours, we have to keep our hand and we have to check if the head is descended or not. They go, when it is 10 o'clock, they have kept and they have felt 3 out of 5. So, on 3, they have marked. Okay, and after 2 hours, they have again checked. It is same in the station 3 only. We call it station. You know what is station? Acha. See, this is pubic this is spine, iliac spine. Okay, inside the pubic bone, when you do PV, no, this is this is, sorry, ischial spine. This is 2 prominent spines. It is located on the ischium bone. When we do pervaginal examination, you can feel this 2 tubercles also. Okay, see, this level we call 0 station. When it crosses here, this is 1, 2, 3, 4, 5. Okay, for every 1 centimeter, we call it, this is 1 station, this is 2 station, station 3, 4, and same vice versa. If it is here, it is -1. If it is here, it is -2. 1 centimeter above and above. So we call it station. See, in this, there is constantly, it is in 3rd station only. Station -3. Mane, at 3 fingers palpable, constantly from 10 o'clock to 5 o'clock, it is at the same. station, মানে head has not descended, মাথা নিচে আসেনি, that we can understand. Okay, after this there is contraction, uterine contraction. Uterine contraction, see they have shaded something and they have marked darkly. This we check how much contractions are there for 10 minutes. ওকে, পেট মানে পেটের আমরা হাত দেব 10 মিনিট, আমরা হাত দেব 10 মিনিটের মধ্যে কত কন্ট্রাকশনস আসছে। when there is labor, no, uterus will contract, it will become hard, that we can palpate in our hands actually. so যখন মাদার শুয়ে আছে আমরা হাত দিচ্ছি পেটে, ঠিক আছে, and for 10 minutes we have to keep our hand, see there is contraction. Okay, I am gotten, there is again contraction, second contraction, there is again contraction. So for 10 minutes 3 contraction or 4 contraction, 5 contraction, how much contraction is there, we have to check. That they have mentioned. See, in this there is 3 contractions, 1 2 3, 3 contractions, and here see 1 2 3 4, there is 4 contractions in 10 minutes, but they have shaded here, এখানে পুরো dark হয়ে গেছে. What does that mean? The contraction which is lasting, no, if it is less than 20 seconds we have to dot, if it is 20 to 40 seconds we have to shade, if it is more than 40 seconds we have to dark it. So this is a contraction, see it is there, 1 2 3 4 5, like that. If it is till 20 seconds we have to put dot, if it is 20 to 40 seconds we have to shade, if it is more than 40 we have to একদম মানে ডার্ক করতে হবে। see in this one, see এখানে এরকম ডট দিয়েছে, means there are 2 contractions which has lasted less than 20 seconds, and see here there are 3 contractions which has lasted 20 to 40 seconds. Here there is 3 contractions which has lasted more than 40 seconds. ঠিক আছে, after this there is a column for oxytocin. আমরা মানে মাঝখানে if we had given any oxytocin or not, if we have given we will mark it. After that what drug we have given, apart from oxytocin আমরা অন্য কিছু ড্রাগ দিয়েছিলাম কি না, that we have to note. Here the BP, the maternal BP, okay, and pulse rate, temperature and urine, this is maternal component. So there is fetal component, labor component and maternal component. Maternal blood pressure we have to check, blood pressure we have to check every 4th hourly, pulse heart rate we have to check every half an hourly, urine and temperature we have to check every 4th hourly. ঠিক আছে, টেম্পারেচার কত আছে মার্ক করেছি, দেন ইউরিনের প্রোটিন আছে, অ্যাসিডন আছে, ইউরিনের ভলিউম কত আছে we have to mark. Okay, see this partograph you will understand. Okay, see we have got the patient at 9 am. Okay, আমি একটা partograph দেখেছি. See in labor room, no, there will be like many patients. If for example 10 patients are there, I am going inside labor room and I will not know what had happened before for that, but if I see the partogram of that patient, no, I can understand, okay, she has gone through this much progress, her vitals is this, her maternal BP eto chilo, pulse eto chilo, fetal heart rate normal chilo, কত dilation হয়েছে, কত descent হয়েছে, এগুলো আমি জানতে পারবো যখন আমি লেবার রুমে যাচ্ছি. So this record is very important. See patient has admitted at 9 o'clock. 9 o'clock she has come, see they have started 9 o'clock. At first are 9, 10, 11, 12 and so on. Okay, at 9 o'clock how much her dilation was is 5 centimeter. So patient when came only she is more than 4 centimeter. So straight away when she came আমরা x দিয়েছি on 5 centimeter. ঠিক আছে, at the time we have measured fetal heart rate. Fetal heart rate is 120. Okay, after that also it is 130. Then we checked for amnion. Amnion is clear. Amniotic membrane is clear. Molding is there. Molding is not there. So molding is 0. And we have checked for the descent. Peter amra হাত দিয়েছি. See, and it is 3 out of 5 palpable. So আমি একটা dot দিয়ে mark করেছি. Then again I am coming down. I am keeping hand on the uterus. I am checking for contraction for 10 minutes. So that contraction, there are 4 contractions which has lasted for 20 to 40 seconds. So that is why I have shaded. And then I have checked the mother's blood pressure. Blood pressure was between 80 to 110. This arrow in this niche is 80, above 110. Systole and diastole. And I have checked the heart rate. Heart rate is 80. So after another half an hour it is 90. After then it is again become 80. Likewise they have marked. Temperature is 36.5 degree. See, protein is not there, acetone was not there, urine volume was 250 ml. Okay, then again dekho, after 4 hours I am again doing PV examination at 12 o'clock. Okay, at 12 o'clock I am seeing it has dilated 8 centimeter. 8 centimeter dilation hoyeche. And fetal heart rate dekhechi. Fetal heart rate is also normal, between 120 to 160. 120 আছে. Amniotic membrane fluid clear আছে. Descent কত হয়েছে? See, head has from 3 station, it has come to 0 station. মানে 3 থেকে 2 হয়ে তারপর 1 হয়ে 0 এসে গেছে, মানে স্টেশন 0. স্টেশন 0 মানে it has come to the ischial spine. At the level of ischial spine it has come. That I have marked. তারপর contraction কত হচ্ছে দেখেছি. There are 5 contractions which are lasting more than 40 seconds. That I have marked. তারপর oxytocin কিছু দিয়েছিলাম কিনা, oxytocin কিছু দেওয়া নেই. Then again maternal blood pressure কত আছে, heart rate আছে. We have to mark it like this. Okay, now if they will give you a partograph in your hand and they will tell you explain the partograph. Okay, so now we can see the labor has progressed very well. It is between the alert line and action line. Okay, from 4 centimeter till 10 centimeter it has crossed. Cervix is fully dilated. Molding, station 0 হয়ে গেছে. Spontaneous vaginal delivery at 1:20 p.m. Baby normally deliver হয়ে গেছে. But if this line had crossed the action line, we should have done something. আমাদেরকে কিছু cesarean section বা কিছু oxytocin দিয়ে induction করতে হয়ে যেত. Okay.